I am Koyurime Emisidro, and today we are going to perform the Perilite exposure. So, the application of Perilite exposure on the perineal area of the patient will provide comfort as well as it will increase the blood circulation and it may hasten the wound healing of the patient by the use of the perennial light. So, this procedure needs to undergo steps such as the assessment, planning, implementation, and evaluation. For the assessment, first is we need to check our patient's condition. So, good day ma'am. May I ask po, how are you today po? So, you're okay po. Do you feel any discomfort po, most especially on your perineal area po? So, wala naman po. So, that's good po, ma'am. So, after that, we will now proceed on the planning. So, for the planning, first is we need to gather all of the equipments that are to be used throughout the procedure. So, first is we need to have our Perilite or headlamp. And then, we need to have our blankets. And then, we need to have our perennial flushing set. So, after that, we need to make sure that all of the equipments are in good working condition. So, we need to switch it and then turn it on and off to see if the equipments are working. And then, we need to make sure that prior to performing or handling the equipments, we need to make sure that our hands are dry. So, after that, for the implementation, first is we need to check the doctor's order. So, for this patient, the doctor's order states that the patient needs Perilite exposure, most especially on the perineal area of the patient, that will last for 15 minutes. And then, after that, we need to introduce ourselves to our patient, verify our patient's identity, and then we need to explain on our patient on how they can cooperate throughout the procedure. So, good day ma'am, I am Koyurime Isidro po, and I will be your student nurse for today. I will be the one po who will gonna perform the Perilite exposure. May I know your name po, ma'am? Yes po, ma'am Ayana. Also, ma'am, may I look at your wristlet? So, it states here po that Ayana Nako, sex female, bed number 1. So, birth up date po is June 9, 1998. Is that true po, ma'am? Okay po. So, Perilite exposure po will be performed po to provide comfort on your perineal area po. Also po, ma'am, it will increase the blood circulation that may hasten the wound healing recovery po. So, ma'am, you can cooperate po later by not touching the lamp and by not changing your position po so that the therapy will be beneficial po. Is that okay with you po, ma'am? Okay po. So, after that, we can provide our patient's privacy by closing the doors or the curtains so that our client will be more comfortable and secured as we perform the assessment. And then, we will perform hand hygiene or any infection control technique to prevent the cross-contamination between the nurse and the patient. And then, for this procedure, we need to have an adequate lighting for better visualization. So, after that, we now need to render perennial flushing. So, we will prepare our patient and then we will expose the parts that will be assessed or that will be cleaned. So, we will perform perennial flushing. So, ma'am, I will now perform perennial flushing po on you before we start the Perilite exposure po. So, we will clean your perineal area po before we start to prevent any infection po. So, we will make a bath mitt and then we will dump it in the water. And then we will clean the perineal area of the patient by making sure that we will follow the rule of 7. So, make sure to clean it on a cleanest to dirtiest manner. And then, dump it again with the water and use other side of the bath mitt. And then, make sure to use different quarters of the blanket or of the washcloth on different areas of the patient's perineum. So, after performing the perineal flushing on the patient, we need to make sure that we will thoroughly dry the perineal area of the patient because moisture will provide or may cause bacterial growth. So we will pat dry the perineal area of the patient. Make sure that you are following the different quarters from different areas. And then, after pat drying the perineal area of the patient, it is now the time for us to remove the linen pad. So, ma'am, can you move on the side po? Okay po. And then, move on the other side po, ma'am. Okay po. So, after that, we will now ask our patient to position into a lithotomy position wherein both knees must be bended and then legs must be apart. So, ma'am, position yourself po in a lithotomy position and I will assist you po. So, after that, we will now perform draping to the patient to provide comfort and security. So, we will do the diamond draping. And then, after performing the diamond draping, we can now put the Perilite under the patient's blanket for approximately 18 to 24 centimeters away on the perineal area of the patient to avoid burning. So, we will put it. And then, we need to make sure that we will regularly assess or check our patient if there are any irritations, burnings, or untoward reaction. So, assume that 15 minutes is already done or as per doctor's order for the duration of the therapy. Now is the time for us to remove the Perilite under the blanket. And then, we will assess if there are any untoward reactions such as irritation or burning. So, there are no untoward reaction found on the patient. So, now is we will make sure that all of the equipments are still in good working condition for the future uses. And then, we will now help our patient into a position of comfort. So, ma'am, you can now change into a more comfortable position po. So, I will assist you po. And then, I will put blankets po to provide you warm and comfort. So, are you okay now, ma'am? Okay po. So, after that, we will document all our findings on our patient's record, and then we need to make sure to perform aftercare on the equipments that are used, such as we need to place them on their proper placement. For the evaluation, we need to make sure that we will perform follow-up checks on the findings that are deviated from normal. Also, we need to report them on the appropriate personnels with regard to the case. So, that ends the Perilite exposure.